Okay, dear colleagues, let's begin. Today's theme is lumbosacral plexus. First question which we should study is composition of lumbar, sacral, and coccygeal plexuses. Now we can see the scheme where is seen that each of spinal nerve is designated like thoracic 12, lumbar first, lumbar second, lumbar third, lumbar fourth, lumbar fifth, sacral first, sacral second, sacral third, sacral fourth, sacral fifth, and coccygeal spinal nerve. And first of all, I'd like to point out that all these spinal nerves are traveled parallel to each other, and they connected with each other, and this connection forms plexuses. What kind of plexuses? First of all, lumbar plexus. We can say that lumbar plexus, according to this scheme, originates from 12 thoracic to 4th lumbar spinal nerves. So these nerves are origination for plexus lumbalis. Here it is. And then we can demonstrate that sacral nerves from 1st to 4th, they are origination for the plexus sacralis. And very important, what is designated with these arrows, that lumbar plexus and sacral plexus, they are connected with each other through lumbosacral truncus, truncus lumbosacralis. So it's clear that lumbar plexus and sacral plexus, they are not distinct. They are not placed different from each other, but they are whole, united in large lumbosacral plexus. And also, we can find that in the caudal place, two segments, 5th sacral and coccygeal spinal nerves, they are origin for coccygeal plexus. So we can say that there is a large lumbosacral coccygeal plexus which united from 3 different plexuses: lumbar, sacral, and coccygeal. And now let's try to study lumbar plexus. I use again the same scheme, but only superior part of it. And again, let's repeat. Thoracic 12 spinal nerve, its prolongation will be named as nervus subcostalis. Then, first lumbar spinal nerve, its prolongation named as nervus iliohypogastricus. And also, from this first spinal nerve, branching nervus ilioinguinalis. So we can see that these three nerves, subcostalis, iliohypogastricus, and ilioinguinalis, all of them are parallel traveled nerves which goes from above down in this arrangement. Then we can find that second lumbar nerve is origin for nervus genitofemoralis. Nervus genitofemoralis is the result of two connecting nerves, ramus genitalis and ramus femoralis, which are united in this nervus genitofemoralis. And then nervus cutaneus femoris lateralis, which originates both from second and third spinal nerves, and most large nerve, which is written here with bold, nervus femoralis. It's most thick, it's most important nerve in plexus lumbalis. And at least here, number L4, fourth lumbar spinal nerve, originate nervus obturatorius. So you should know all these nerves, subcostalis, iliohypogastricus, ilioinguinalis, genitofemoralis, cutaneus femoris lateralis, femoralis, and nervus obturatorius. All of them, and each of them, are the branches of lumbar plexus. Now, let's try to find the same nerves in anatomical pictures. We use the picture from very famous Atlas of Human Anatomy of Frank Netter. What can we see here? Vertebrae from 12 thoracic to coccygeal. Each of them are designated as thoracic 12, lumbar first, lumbar second, and so on. And here, when foramen intervertebralis is situated, we can find nerves. Most superiorly located nerve is nervus subcostalis. Nervus subcostalis, here it is. then we can say that plexus lumbalis is formed from these spinal nerves, which we can find in this region from 12th thoracic to 4th lumbar. And more caudally, we can find sacral plexus, plexus sacralis, which originates from spinal nerves passing through foramina sacralia pelvina, the foramina on anterior surface of os sacrum. And very small coccygeal plexus, which is composed from two small branches, fifth sacral and coccygeal, which form nervi anococcygia. Nervi anococcygia. Here it's written, nervi anococcygia. And let's try to find here each of branches of lumbar plexus. This is nervus subcostalis. This is nervus iliohypogastricus, and then ilioinguinalis. Here they are. All of them goes parallelly to each other. Then this yellow is nervus cutaneus femoris lateralis. Here it is, cutaneus femoris lateralis. This most large is nervus femoralis. It passes through this place, which is named lacuna musculorum, between inguinal ligament and coxal bone, and this place where it can be found in our specimen under inguinal ligament. It's very important to distinguish this nerve. And now we shall compare this picture with another. What is different from previous picture? We can see not only bones, but also muscles. Here there are muscles of abdominal cavity. Here it is the diaphragm, its upper wall of abdominal cavity. Here it is the muscles of back or posterior wall of abdominal cavity, exactly musculus quadratus lumborum, musculus psoas major, and here there are muscles of lateral wall of abdominal cavity from superficial to the most deep layer. They are musculus obliquus abdominis externus, obliquus abdominis internus, and musculus transversus abdominis. For us, it's very important how to find the nerves. First nerve, nervus costalis, then nervus iliohypogastricus and ilioinguinalis. Practically, they goes not simply parallel to each other, but in the same structures between the muscles of lateral wall. And most inferior from these three nerves, nervus ilioinguinalis, it passes into inguinal canal, and then we can find them also in the scrotum, on the anterior surface of seminal canal, canalis inguinalis and vas deferens. So now we have found three nerves, and then fourth, this is nervus cutaneus femoris lateralis. You can find that it passes also behind the inguinal ligament and branching in the subcutaneous fat of anterior surface of thigh. Then, very interesting nerve, nervus genitofemoralis. Here it is. Genitofemoralis, here branching into ramus genitalis and ramus femoralis, and the peculiarity of this nerve is that it passes through, it penetrates this muscle. What is this? Musculus psoas major. Another four nerve which we previously studied, they passed behind musculus psoas major, but nervus ilioinguinalis penetrates this muscle. And at last, here, nervus femoralis. It's difficult to demonstrate it here, but nevertheless, we can find that it passes between musculus psoas major and musculus iliacus in this gap, and then it will be placed between muscles of anterior surface of the thigh. And these most inferior located spinal nerves are an origin of sacral plexus. So, practically, we found here all nerves of lumbar plexus except nervus obturatorius. Here it is, nervus obturatorius. And now I'd like to demonstrate them in our specimen. First of all, I'd like to use our specimen where the organs of abdominal cavity were removed. I'd like to demonstrate you for your recognizing this muscle. It's musculus psoas major. This is musculus iliacus, and here it is quadratus lumborum. And nerves which we are looking for, most of them are originates behind musculus psoas major. So this is number first nerve, nervus subcastalis. Here it is, nervus subcastalis. Nervus subcastalis. How I recognized it? It's possible to palpate the rib. It passes close to this 12th rib and parallelly to it. It passes behind musculus psoas major. Then I'd like to demonstrate another nerve, nervus cutaneus femoris lateralis. Here it is, cutaneus femoris lateralis. Nervus cutaneus femoris lateralis. It passes close to spina iliaca anterior superior and then shall be located in lateral surface of the leg, and I'd like to demonstrate it here. Cutaneus femoris lateralis. Here it is. Nervus cutaneus femoris lateralis. Nervus cutaneus femoris lateralis. Now, let us try to find these structures. What is this? It isn't nerve. It's a vessel. It's so named gonad arterias, either ovarian arteria, either testicular arteria. We can't distinguish in this specimen, is it ovarian or testicular, because there are no any reproductive organ, and it's impossible to recognize is it specimen of male or female. So this is arteria for gonads. Then here you can find the ureter. Here it is ureter. And close to it, nerve, nervus genitofemoralis. Here it is. How I recognized it? Because it's penetrate the musculus psoas major and not pass like this nerve behind of it. So nervus genitofemoralis we can recognize by fact of penetrating, passing through musculus psoas major. And it's interesting that nervus genitofemoralis sometimes divides into two branches, ramus genitalis and ramus femoralis, but sometimes they are distinct from the beginning, from the origin, and in our situation is exactly such. So this is ramus genitalis, and this is ramus femoralis of nervus genitofemoralis. They go distinctly from each other, parallelly to each other from the beginning. Nervus genitofemoralis, ramus genitalis, and ramus femoralis. And most large nerve, nervus femoralis. Here it is, nervus femoralis. We can find that it is located between musculus psoas major and between musculus iliacus. So nervus femoralis passes through lacuna musculorum. I'd like to demonstrate lacuna musculorum. Here it is, this place between hip bone and between inguinal ligament. So lacuna musculorum. Through it, nervus femoralis passes to the thigh. And I'd like to demonstrate nervus obturatorius. Nervus obturatorius. Nervus obturatorius. Nervus obturatorius. Here it is. We can find it in the pelvis minor, on the lateral wall, and it passes through foramen obturatorium, and then from another side, here it is, nervus obturatorius, here it is, and now I shall demonstrate it in our large specimen on the thigh. Here it is, nervus obturatorius. Nervus obturatorius. You can see that here, to demonstrate it, some muscles of adductor group were cutted, and that's why we can find it here. But from opposite side, it isn't seen here. Why? Because these muscles of adductor group were not cut, and that's why it isn't seen. And again, this nerve, nervus femoralis. This is nervus femoralis on anterior surface of thigh, nervus femoralis. You can see how much branches it make. So all of them innervates the muscles of anterior group of the thigh, and several of them form the cutaneous nerve, which is interesting term, nervus saphenous. Here it is, nervus saphenous. Nervus saphenous. This is infrapatellar branch of nervus saphenous, and it's quite long. It passes through a special canal in right leg. It's good seen. This is canalis vasto-adductorius, or Gunterov canal, canal of Hunter, or Hunter, but in Russian tradition it's named as Gunterov canal. So again, nervus femoralis and its branch nervus saphenous. Okay. Let's continue our presentation. Now, next interesting question, skin innervation of thoracic and abdominal region. I'd like to remember you that there is cervical plexus, there is brachial plexus, there is lumbosacral plexus, but there is no thoracic plexus. Why? Because thoracic nerve, they goes parallelly to each other without connecting with each other. So they do not perform the plexus. And that's why when we think about innervation of skin of thoraco-abdominal wall, it's very important that all skin innervation in this region is result of parallel pathway of rami cutanei anterioris nervi intercostalis from 1st to 12 intercostal nerves. It's very interestingly that abdominal wall, very often we can find situation that after surgical operation, a man don't feel any sensitive pain or temperature or touch feeling from small region of the abdominal cavity due to these small nerves were cut it during surgical operation. In region of scar, these small branches were cutted. And interesting that practically all anterior abdominal wall is innervated by intercostal nerves. There is no one ribs here. No one ribs we can find here on the abdominal wall. But nevertheless, this region of anterior abdominal wall is innervated by intercostal nerves from 7th to 12th. And lateral surface of thoraco-abdominal wall has their own branches, which is named rami cutanei lateralis, and they belongs the same intercostal nerves, and practically they are branches of same nerves. And only 12 intercostal nerve named especially as nervus subcostalis. It's designated here with green dotted line circle, which are ramus cutaneus anterior of nervus subcostalis belonging to 12th thoracic nerve. And only one special nerve of this yellow green dotted circle is ramus cutaneus anterior of nervus iliohypogastricus. Ramus cutaneus anterior of nervus iliohypogastricus. So for us, it's very important information for understanding what nerves perform skin innervation of abdominal wall. And now let's try to study nervus femoralis more detailedly. First of all, let's find that it originates here from first to fourth spinal nerves, then they connected with each other. Then you can see it behind the carotid nervus musculus psoas major, and here it passes through lacuna musculorum into anterior surface of thigh. It's written here muscles which are innervated by it: musculus rectus femoris, musculus vastus intermedius, musculus vastus lateralis, musculus vastus medialis, and all of them, all four of them, are musculus quadratus femoris. And also, it's seen that it innervates musculus sartorius and musculus pectineus. So this nerve is nerve for anterior muscles of thigh. And also we can find nervus saphenus as skin branch of it. It passes through canalis vastoadductorius or canalis of Hunter, and then we can find it on the medial surface of leg. On right part of picture, we can see the skin innervation, and nervus saphenus is seen here as blue region on the medial surface of leg, and anterior surface of thigh is innervated by nervi cutanei anterioris from nervi femoralis. Here they are, nervi cutanei anterioris. So this blue region is region of innervation from nervus femoralis. Then, next large nerve belonging to the sacral plexus is nervus ischiadicus. Let's try to find all structures on it. Nervus ischiadicus. Here it is the posterior surface of inferior extremity. And we can say, similarly, nervus radialis is posterior nerve of upper extremity. Nervus ischiadicus is posterior nerve of lower extremity. It's interesting that we can find it only in posterior part of the leg, of the low extremity, and here it is, this place where it's situated. It's foramen ischiadicum majus, foramen ischiadicum majus, or exactly foramen infra piriforme, where it appears from pelvic cavity. So you understand that it originates in anterior surface of sacrum, but then through foramen infrapiriforme, it passes to posterior surface And exactly here we can find it on the specimen. Then, usually in superior point of the popliteal fossa, it divides into two main branches, nervus tibialis, here it is, and nervus peroneus communis. Peroneus means fibularis, but more often used term, nervus peroneus communis. And each of them has its own place of innervation, but nevertheless, we can find two small branches, cutaneous branches, which named ramus cutaneus sure medialis and ramus cutaneus sure lateralis. They connect with each other and innervates the lateral surface of leg. Here, with pink or reddish color, we can find the region of innervation of nervus suralis, lateral region of innervation. And close to it, we can find a quite long cutaneous nerve which innervates posterior surface of thigh, nervus cutaneus femoris posterior. This blue region demonstrates nervus cutaneus femoris posterior. And now let's try to find this nerve on our specimen. First of all, I'd like to demonstrate that it's necessary to turn specimen with posterior surface, and here it is nervus ischiadicus, nervus ischiadicus. I said that it passes through foramen infrapiriforme. Here it is. This is number 126 is musculus piriformis. And according to this muscle, we can find two foramina, foramen infrapiriformis and foramen suprapiriformis. Nervus ischiadicus passes through foramen infrapiriformis. And by the mean, here number 97 is nervus gluteus superior. Nervus gluteus superior. Nervus gluteus superior, which is nerve for innervation gluteal muscles. Nervus ischiadicus divides into two main branches. Nervus tibialis, here it is, nervus tibialis, passing medially, and nervus fibularis, or peroneus communis, nervus peroneus communis. Here it is, nervus peroneus communis. More inferiorly, it enters to the special canal for this nerve, canalis musculus peroneus superior. Here you can see that nerve was hidden in this canal. Nervus peroneus communis enters to canalis musculo peroneus superior. So, two large nerves as branches of nervus ischiadicus we can find here. And on the left leg, we can find that nervus tibialis here make branch nervus cutaneus sure medialis. Nervus cutaneus sure medialis. Here it is. Number 136. Cutaneus sure medialis. And close to it, we can find nervus cutaneus sure lateralis. Cutaneus sure lateralis. It's designated as 135, cutaneus sure lateralis. And they connect with each other and form nervus suralis, number 103. Nervus suralis, number 103. And nervus suralis innervates skin of lateral surface of the leg till the lateral surface of dorsal foot, dorsal part of foot. So, nervus suralis. And before we return our specimen in anterior position, I'd like to demonstrate to you this nerve, nervus cutaneus femoris posterior, number 98, cutaneus femoris posterior. Sure, according to its name, it innervates the dorsal surface of the thigh, but it's very interesting that from it we can find a branch, nervus cluneum inferior, nervus cluneum inferius, number 58. Cluneum inferius. It's very important and interesting that nervus cluneum inferius, which innervates inferior part of the gluteal region, it is nerve of sacral plexuses. But we also know two another nerves with this name, nervus cluneum superius, number 56, nervum cluneus superior, and nervum cluneus inferior, nervus cluneum medius, number 57. They are known to us from last lecture as not part of plexus, but as special dorsal branches of spinal nerves, which are famous because they have a special name. Only 5 of posterior branches of spinal nerves make their own name: cluneum superior, cluneum medius, subaccipitali, accipitalis major, accipitalis tertius. And only they have name, but another only numerate as thoracic first, thoracic second, and so on, so on. So we now turn our specimen, and I'd like to demonstrate you nervus peroneus superficialis. Nervus peroneus superficialis. Here it is. Nervus peroneus superficialis. It's nerve which innervates dorsal part of the leg, and close to it we can find nervus peroneus communis, which is placed only between first and second peroneus profundus, nervus peroneus profundus, which is placed only in region between first and second fingers of foot. Nervus peroneus profundus. So let's return to our presentation. Thank you. And now let's discuss the skin innervation of the dorsal part of the leg and dorsal part of the foot. What can we see here? Dorsal part of leg and dorsal part of foot, and I hope you recognize two malleoli, malleolus lateralis, more inferiorly localized, and malleolus medialis, more superiorly. We can palpate it, and not only palpate, but even see. And also, for us, is helpful these two structures of connective tissue, which are retinaculum extensorum superius, this flat band which support all the muscles from anterior surface, and retinaculum extensorum inferior, which have a shape as Greek letter E, Y, this retinaculum extensorum inferior and retinaculum extensorum superior. For us, it's helpful that under these retinaculi we can find nerves from medial surface, nervus saphenus. It finishes here on medial surface and innervates medial surface of dorsal part of the foot and leg. Then, from lateral position, we can find nervus peroneus fibularis superficialis. Peroneus or fibularis, it's the same. Nervus peroneus superficialis. This abbreviation SFC means superficialis. Nervus peroneus superficialis. Then we can find that it divides into two branches, nervus cutaneus dorsalis medialis, nervus cutaneus dorsalis medialis, and nervus cutaneus dorsalis intermedius. They are branches of nervus peroneus superficialis. But if there are nervus cutaneus dorsalis medialis and intermedius, sure we can find nervus cutaneus dorsalis lateralis. Here it is, nervus cutaneus dorsalis lateralis, but it belongs not to nervus peroneus superficialis, but to nervus suralis. You remember, suralis passed from the posterior surface of the leg. Nervus suralis is an origin of nervus cutaneus dorsalis lateralis. So with this name, nervus cutaneus dorsalis, we have three nerves, cutaneus dorsalis medialis, intermedius, and lateralis. Two of them are branches of nervus peroneus superficialis, and lateral nerve is finishing, ending branch of nervus suralis. And practically, all the fingers on dorsal surface of the foot are innervated by these nerves, except this small region of adjacent two fingers, first and second fingers of the foot. It's nervus peroneus or fibularis profundus. Nervus peroneus profundus. And it branches into nervus cutaneus hallucis lateralis. Hallux is name of first finger in foot, and cutaneus digiti secundi medialis. So these two adjacent surfaces of first and second fingers of the foot are innervated by nervus peroneus profundus. So, skin innervation of the leg we already know, and now I propose you to test yourself. I demonstrate you the anterior surface of inferior extremity and nerve which passes here on anterior surface of the hip bone, and then each of these red point means muscles which it innervate. And this is cutaneous branch of this nerve. What is it? It's, I hope you understand that this is nervus femoralis, most important and most large nerve of lumbar plexus. It's a good picture for demonstrating that muscular innervation is here on the anterior surface of thigh, and cutaneous innervation is not on the thigh but also on the medial part of leg. Now let's discuss it more detailedly. I use the same picture and now propose to name this structure. What is this? It's musculus iliopsoas, muscle which is result of connection of musculus iliacus, placed here, and musculus psoas major. Musculus iliopsoas, it's innervated by nervus femoralis. For you, it's very important to remember each muscles which are en route to innervation by this nerve. It's written in Russian, we shall translate that it's anterior muscles of thigh. And exactly, they are quadratus femoris, musculus quadratus femoris, and also musculus sartorius, which are innervated by nervus femoralis. And here, this arrow demonstrates the ramus infrapatellaris, and next arrow, nervus saphenus. Ramus infrapatellaris is part of nervus saphenus, branch of nervus saphenus. Nervus saphenus is most longer branch of femoral nerve, which make cutaneous innervation from practically till the first finger of foot. And now we use this scheme for demonstration skin innervation of nervus femoralis. These two group of branches, nervus saphenus in inferior part of skin and rami cutaneae anterioris in superior part of this skin. It's skin innervation for this nerve. Another example. What is this? Again, anterior surface of low extremity. Nerve isn't long, quite short. It passes to the medial surface of thigh, and what is the nerve? I hope you answer. Nervus obturatorius. Let's find all the detail. This is trunk, main trunk of nervus obturatorius. Then, after passing through foramen obturatorium or canalis obturatorius, it should be demonstrated that muscles, musculus obturatorius externus, and group of adductor muscles of thigh are innervated by this nerve. Also, it have cutaneous branches, especially ramus anterior and ramus posterior, and this skin region is placed here in the middle part of thigh from medial surface. And now, next question. it's posterior surface of the leg. Also, we can see that this nerve, you can say, was cutted in this picture, but really it traveled distally to the leg, to the foot, and we should answer what is the nerve. If this is posterior surface, the only one answer, right answer, should be it's nervus ischiadicus, because nervus ischiadicus is posterior nerve of lower extremity, as nervus radialis is posterior nerve of upper extremity. The same. And let's try to designate. This is nervus ischiadicus, and it innervates musculus adductor magnus as part of adductor group, and also the posterior group of muscles of thigh, that it's written here in Russian, posterior group of muscles of thigh. And distally, it divides into nervus tibialis and nervus peroneus communis. Peroneus or fibularis. Peroneus or fibularis communis. How we can distinguish peroneus and tibialis? Because nervus peroneus should be on lateral part of the inferior extremity. So, like peroneal bone, also and peroneal nerve are located laterally. So we can distinguish them. And now, very also helpful, the end part of previous picture. It's interesting that here we can see anterior surface of leg. And here it is, from lateral aspect, we can find this nerve. It's peroneus communis, nervus peroneus communis. Here it is, nervus peroneus communis. Now, nervus cutaneus sure lateralis, small branch of it, which will connect with cutaneus sure lateralis for forming nervus suralis, and then more distally muscle innervation. It's written in Russian that for lateral muscles of leg and from medial part for anterior group of muscles of leg. And it ending as nervus peroneus superficialis and nervus peroneus profundus. And we already said that nervus peroneus profundus will innervate only adjacent parts of first and second fingers of foot. And here, skin innervation, lateral part is innervated by nervus cutaneus sure lateralis, and anterior part with nervus cutaneus or rami cutanea dorsalis, and nervus peroneus profundus only adjacent part of first and second toes. And if we try to locate the same structures on dorsal surface of the leg, we can find next muscles and skin innervation. I'd like to point your attention here on the posterior surface of skin innervation and nervus suralis as a result of connection nervus cutaneus sure medialis and cutaneus sure lateralis. The plantar surface of the foot of the foot is innervated by nervus plantaris lateralis and medialis, branches of tibial nerve. And last pictures very useful for repeating skin innervation of lower extremity. Right part of this picture is anterior surface, left part is posterior surface, and we should know all these skin region. Number one is nervus iliohypogastricus. It's ramus cutaneus lateralis. Number two is nervus femoralis. Ramus femoralis, nervus genitofemoralis. Number three is nervus cutaneus femoris lateralis. Number four is rami cutanei femoralis anterioris. That means nervus femoralis. Then number 4A, why we use the same number? Because it's branch of nervus femoralis, nervus saphenus. 4A, nervus saphenus. Then we use number 4 as nervus obturatorius. Then number 6, here it is, number 6, only on dorsal surface, it's nervus cutaneus femoris posterior. Then number 7A, both in anterior and posterior surface, is nervus cutaneus sure lateralis. 7B is cutaneus sure medialis. And 7C, nervus suralis here, there. Number 8, only in anterior surface of foot, is nervus peroneus superficialis, and number 9 is nervus tibialis. Nervus tibialis, which will divide it into nervus plantaris medialis, plantaris lateralis for soleus region. And this gluteal region also we innervate number 11, nervi clunei superiores, number 12, nervi clunei medii, and number 13, nervi clunei inferioris. It's important to repeat that only number 13, nervus cluneum inferior, is branch of sacral plexus. But another two are posterior branches of spinal nerves. And I'd like propose you these two last table. Motor nerves of lower limb, and next will be sensitive nerves of lower limb. It's very useful table from famous Grant's Atlas of Anatomy. I recommend you to make then a pause, screenshot, and print on the paper. Very useful to understand detail of innervation. And this is cutaneous nerves of lower limb. Again, the same recommendation to make screenshot and to print it on the paper. So, before to end our lecture, I'd like to repeat that for good estimation, you should demonstrate main nerve on specimen, number 1, to know skin innervation and motor innervation of extremity, and to know the pathways of each nerves and their topography. So, lecture is over.